Hi, I'm Ryan Curran, and this is my presentation on panic disorders for Dr. Dominic Sturz Kinesiology 302 class. So, what is panic disorder? According to the National Institute of Mental Health, panic disorder is an anxiety disorder that's characterized by unexpected and repeated episodes of intense fear accompanied by physical symptoms that may include chest pain, heart palpitations, shortness of breath, dizziness, or abdominal distress. These episodes occur out of the blue and seem to be caused by no obvious external factors. One of the things that makes panic disorder and panic attacks so difficult to deal with and to explain is that a lot of times when the onset of panic and fear first happens, there is no external stressors or nothing obvious that is causing this fear to happen. Many people compare the feeling of a panic attack to that feeling of fight or flight that one might get if a bear was suddenly face to face with a person walking or hiking down a trail. During a panic attack, much like if a bear jumped out at you while hiking, the part of your brain which is called the amygdala, which is responsible for the fight or flight mode, goes into overdrive. Now, the tricky part about a panic attack is that unlike when a bear has jumped out at you, there's nothing for you to set your sights on to know whether what is threatening you has gone or is still there. And that is the main reason that panic attacks tend to spiral and go over and over and over again, and they don't just go away, because that bear, which might be the external stressor, does not actually exist. There's not actually an external stressor, and because of that, the human's brain continues to try to look for a stressor or a stress factor, and they can never locate it, and therefore the panic attack spirals and gets worse and worse. Another description to help us understand what a panic attack physically feels like came from the article When Fear Overwhelms, and this is from an actual patient who has panic disorder and has been diagnosed. And to this patient, they say, quote, "One day, without any warning or reason, a feeling of terrible anxiety came crashing down on top of me. I felt like I could not get enough air, no matter how hard I breathed. My heart was pounding out of my chest, and I thought I might die. I was sweating and felt dizzy. I felt like I had no control over the feelings, and I was drowning and couldn't think straight." Now, the reason I'm doing this presentation on panic attacks and panic disorder is because I have a very close relationship with panic disorder itself and panic attacks. And my experience is very similar to what we have seen in that last slide, where the person's account of the panic attack was something that was terrifying. It was something that caused them to not be able to think straight. Um, their heart was pounding, they were sweating. This is all very familiar to me, and this is something that when I first started experiencing panic attacks, I legitimately thought I was going to die. And that's something that is a reoccurring theme in a lot of people's descriptions who have panic disorder, who have had a panic attack, is at one point or another when they had it, they legitimately thought they were going to die. And I remember the first time I experienced a full-blown panic attack, I started shaking, I had trouble thinking straight, I wasn't able to put my thoughts together. I actually walked myself down to the medical center at this college that I had been going to at that point, and I started to actually black out. So I had no clue what was going on, and I was trying to be rational. I was trying to think rationally, but when you're having an anxiety attack or a panic attack, actually, your cognitive function has gone very, very low, and it's hard to think through stuff. So I actually ended up in the hospital that day. They took a look at me. They took an EKG. They saw that nothing was wrong with me. They said, that I was having a panic attack, and then I ended up going to a psychologist talking about panic disorder. But yeah, my personal experience is very similar to what most other people have experienced, and I didn't know what was happening. So talking to other people about it and reading other experiences, it's very comforting when you just feel like you feel this thing is so abnormal and it's so extreme. That's one thing I can't say enough is how extreme a panic attack can actually get. And before I started having them, I kind of just brushed them off and thought meant that somebody was getting nervous, and that's definitely not what it means. It definitely panic attack is something very severe, and like I mentioned before, it even gets to the point where you are convinced that you are going to die or that you're actually in extreme danger. Now, why is panic disorder important to current life as we know it? And I think in our modern times where mental health awareness is becoming more and more studied and accepted, I think panic disorder is something that has kind of been overshadowed by some other anxiety disorders. But it's also very important and a lot more common than most people probably think. And as we look at this chart for the prevalence of panic disorder among U.S. adults by percent, we see that 1.6% of males in the U.S. have been diagnosed with panic disorder, and 3.8% of females have been diagnosed with panic disorder. And that's a combined total for 2.7% of the U.S. population who suffers from this mental illness. And that brings me to my thesis statement, which would be panic disorder is one of the most relevant mental health problems in current society because it is extremely common, it is associated with many other mental health issues, and unfortunately, panic disorder oftentimes goes untreated. And I bring you back to the percentage we have here of 2.7% of the U.S. population that has been diagnosed with panic disorder. And that might sound small at first, but I wanted to emphasize that because 2.7% of the U.S. population is around 8 million people. And 8 million people is not a small amount, and there's a lot of people suffering from panic disorder. And that's just what's been diagnosed. We don't know who else is suffering from it or going through it or having panic attacks. So it is a bigger issue than I think we realize. So now I want to talk about the correlation of panic disorder and panic attacks with physical health issues because when we're talking about health, obviously we're discussing mental health when we talk about anxiety and panic disorders, but I also want to talk about how closely related they are to physical health. So let's start here. Panic disorder and physical health. According to cognitive behavioral models, also known as CBT, panic attacks arise from distorted and catastrophic interpretations of bodily symptoms. So what does that mean? Put simply, it means that panic attacks arise from a person's misinterpretation of their own bodily feelings. Exercise involves exposure to physiological stimuli similar to those experienced during panic attacks. Patients often experience anxiety and avoid exercise on purpose. Exercise avoidance and low levels of everyday physical activity turn out to promote a sedentary lifestyle as an indirect effect of panic disorder. And that's extremely significant. The fact that panic disorder is causing patients to actually become more withdrawn from exercise and healthy activities and healthy behavior, because now not only are they being mentally affected by these panic attacks, but they're being physically affected by them. And as we know, living in the United States is one of the biggest causes of death is heart-related death, and along with cancers, we know how important physical exercise and diet actually is. So unfortunately, panic attacks and panic disorder is just another thing that is negatively affecting that already health issue that we have in the United States and all around the world. So now I want to bring up a few more points about how significant panic attacks and panic disorders affect the body physically. So let's start with the first point. Anxiety and panic disorder have recently seen special attention as a potential risk factor for cardiovascular disease, and that's something that I made reference to in the last slide. Notably in terms of the interface between the autonomic changes caused by chronic anxiety and panic attacks and the autonomic mechanisms of cardiac regulation. What does autonomic mean? It means an involuntary or unconscious relating to the autonomic nervous system. And what that means for a panic attack is that a panic attack is subconsciously affecting parts of the human body that have close relation to the heart. And what this means is that in the long run, it can actually have detrimental outcome in relation to cardiovascular disease or putting too much stress on the heart. And as we know, and I've read before, cardiovascular disease is one of the leading causes of death in the United States and in the world. Panic disorder and its association with coronary artery disease may even increase cardiac mortality. Last point is anxiety disorders, including panic disorders, are also found to be culprits in overeating and binge disorders. This greatly affects the overall health of people who have anxiety, both physically and mentally. So another point, why PD is important, is because it's actually causing people to have binge eating disorders on addition to their already panic and anxiety disorders. And that's pretty normal when somebody is going through an anxiety disorder or depression or panic. Binge eating is oftentimes something that is found to be a comfort, kind of like a self-medication for someone going through mental illness. So that, yet again, is another thing that panic disorder is negatively impacting. So on this slide, I want to briefly mention something that is called the anxiety sensitivity cycle. And this is kind of a visual representation of what's going on inside somebody's head during an anxiety attack, during a panic attack, during an episode of extreme fear and panic. So we start with anxiety. I mean, realistically, it's a cycle, so we can start with anyone. But we'll start in the bottom left with anxiety. Anxiety leads to anxiety symptoms. We know a lot of anxiety symptoms are racing heart, sweating, trouble breathing, sometimes hyperventilation, and then that leads to anxiety sensitivity, which means the mental sensitivity towards these anxiety symptoms. You start to become sensitive and you become aware of them, and that would lead to selective attention and something called hypervigilance. Hypervigilance and selective attention is when you become overly aware of anxiety symptoms that you're having. For example, if someone is having an anxiety attack, a lot of times you're going to be extremely focused on, let's say, your pounding heart or your racing heart. And when you become hypervigilant, that means that you are now overly aware of a symptom that probably wasn't as significant as now you have convinced yourself that you think it is. And then that leads to the next bubble, which is increased perception of body symptoms. So, like I said, you become hypervigilant. You start focusing on every single little aspect of what you feel, what you see, your breathing, which can lead to breathing problems in that moment, or it can lead to obviously a panic attack, an anxiety attack, and this just is a kind of never-ending cycle until you get out of the anxiety disorder, or sorry, the anxiety attack or the panic attack. And this can kind of cycle over and over again. It can last 10 minutes, 15 minutes. It can be a couple hours. I've experienced panic attacks that have lasted upwards of 3 to 4 hours. And this cycle is very true in terms of representation of what is actually going on in the brain. So now we're going to touch upon modern treatments for panic disorders and what is happening in modern society to deal with this disorder and deal with this issue. Because we know now that it is a problem and that it is being talked about. And if over 8 million Americans have been diagnosed with this, we know something is going on to help it. So I broke it down into two sections. On the left side, I have medications. And under medications, I have selective serotonin reuptake inhibitors, also known as SSRIs, or more commonly known as antidepressants. And then we have a second category, SNRIs, which is a different type of antidepressant. It works slightly differently than a SSRI would. And then third most, we have a very controversial topic, which is benzodiazepines, which I'm going to touch upon next because it is one of the more frequently talked about methods of medication for panic disorder and anxiety. And on the right side, we have non-medication treatments, which is psychotherapy. And under psychotherapy, we have cognitive behavioral therapy, also known as CBT. And under that is the common psychiatrist and psychologist. And under that category, I'm going to mainly focus on the psychotherapy aspect, which includes cognitive behavioral therapy. So let's talk about benzodiazepines, also sometimes known as benzos. Benzodiazepines are a class of drug that causes central nervous system depression. They have been around since the 70s and took over the role of barbiturates as the most commonly prescribed anti-anxiety and anti-panic prescription drug. Yeah, so back in the 1970s and 80s, barbiturates were more commonly prescribed, and benzodiazepines were developed as a what they saw as a healthier, less addictive form of a central nervous system depressant, which helps with anxiety and panic. And one of the reasons that benzodiazepines were seen to be healthier is because of the way they work on the GABA receptor. On the GABA receptor, benzodiazepines actually they increase the frequency of the GABA receptor and how often, the frequency of how much it opens, whereas a barbiturate would just continuously hold it open and release the chemical in your body, which calms you down. So the next section says the most common benzodiazepines are Xanax, Ativan, Klonopin, and Valium. And there is more than that, but if you're going to talk about benzodiazepines, commonly those are the ones you're going to hear. Although benzodiazepines are greatly successful in their treatment of panic disorder, there has been a huge amount of overprescribing done by doctors, especially in recent years. And more recently, there has been a very large amount of abuse and addiction in relation to benzodiazepines. So here we have a chart to represent the amount of benzodiazepines that are prescribed in the U.S. by the millions, and you can see starting back in 1996, we have just below 8 million, and then we're slowly working its way up. By the time we get to 2008, it's above 12 million, and then all the way up to about 2016, we're just under 16 million, and making it now into 2019, 2020, we are definitely above the 16 million mark. Now, let's talk about why are benzodiazepines so important and why are they the main medication that I'm talking about. So benzodiazepines are important for panic disorder because they work quickly and they can be taken as needed for panic attacks, and that's a big plus right there. They can be taken as needed for panic attacks. Some benzodiazepines like Xanax work within 15 minutes and can last upwards of 6 to 8 hours. Other benzodiazepines take longer to kick in, but they can last anywhere from 10 to 20 to 30 to 40 hours, depending on what medication it is. When someone is experiencing a panic attack, the symptoms usually come on instantly, and the only medication to offset the symptoms that quickly are benzodiazepines because of their quick release and reaction time. That's one of the reasons that Xanax is so often prescribed, because it works the quickest out of all benzodiazepines. On the next bullet point, it says one of the reasons SSRIs, as I mentioned before, which are also called antidepressants, are less successful for panic attacks or panic disorder is because they are sometimes taken and they don't go into effect until a lot of times 3 to 4, sometimes 5 or 6 weeks later. So they can often be prescribed for anxiety, but unfortunately, because of how long they take, there's a large window for a panic attack where they're not as effective until weeks or months later. So now I want to briefly discuss the downside to benzodiazepines, like Xanax, Ativan, Klonopin. One of the biggest downsides is that they are very addictive and easy to build a dependence on, and that's why they are best taken when you are only taking them as needed, which means if you're having a panic attack, that would be the only time you should be taking them. Doctors will prescribe them for different reasons. Some people take them daily, depending on the severity of the panic attacks and how frequently they're going through the panic attacks. But one of the main downsides, aside to building up a tolerance and an addiction to benzodiazepines, is what we're going to look at here on this chart. And we see that this is a chart of the national drug overdose deaths involving benzodiazepines with opioid involvement. And that's a big factor in benzodiazepine deaths, is if they're involved with opioids. And as we can see here on the chart, if we look at the light green line that's almost gray, we see benzodiazepines without any opioids. Deaths caused by someone taking benzodiazepines and not related to opioids. So that can be related to alcohol, it could be in association with another medication, it could be an overdose on benzodiazepines. But if you look at that line stays very, very low and looks like about 500 a year. And then if you go to the darker green line, that's increasing with also the blue bar graphs, we see benzodiazepine deaths in relation with any opioid, and we can see how that has increased greatly, and in 2017 actually led to almost 12,000 deaths. So the main thing to take from this is benzodiazepines become increasingly dangerous when taken with or abused alongside an opioid. So now that we've talked about some of the main topics for medication or prescribed medication for panic attacks, I want to talk about some non-medicated aspects of it. So let's go over psychotherapy. What is psychotherapy? Psychotherapy is the use of psychological methods, particularly when based on regular personal interaction with adults. Um, they help a person change behavior and overcome problems in a desired way. A type of psychotherapy called cognitive behavioral therapy, which is also known as CBT, is especially useful as a first-line treatment for panic disorder specifically. Cognitive behavioral therapy, CBT, teaches you different ways of thinking, behaving, and reacting to the feelings that come on with a panic attack. The attacks can begin to disappear once you learn to react differently to the physical sensations of anxiety and fear that occurred during panic attacks. And that's a very important aspect of panic attacks, is using psychotherapy and CBT to be able to identify and realize that what you're feeling is a panic attack and that you're actually not in any danger. So as we conclude this presentation on panic disorder and modern panic attacks and modern panic disorder, I want to say that panic disorder is becoming more and more talked about and diagnosed every single year. Because of this uptick in awareness, more treatment options are being used and discovered. Some of these treatment options do have a downside, but unfortunately that is the cost of discovering new methods of success. Every year, more people are diagnosed, and every year, more studies are being done around the topic of panic disorder and panic attacks. And me, as someone who has suffered from this disorder, I'm greatly appreciative of all treatments, both medicated and non-medicated. And I look forward to future developments for this mental illness. Yeah, one thing that I can definitely say as someone who's gone through this is there have been times where I'm extremely grateful for speaking to a psychologist, and there's times that I'm extremely grateful for taking a medication. And when it gets severe, it's kind of hard to imagine people who've gone through this in the past, who've gone through the same thing without being able to take a medication for it or maybe be able to talk to someone about it. And a long time ago, actually not that long ago, people who were going through panic attacks were actually seen as being crazy. So it is a blessing that we live in a day and age where there is medication for it, and it can help your day-to-day life greatly, and it can help you get through and get past a panic disorder.